So what Sarah's doing now is she's getting just a pre-op exam performed. She's checking gum color, CRT, which is capillary refill time. Just gives an idea of perfusion, what's going on inside. And then she's also checking heart, make sure there's no abnormal sounds like murmurs or arrhythmias. And then she's taking heart rate as well. She'll take his temperature in a little bit and also his respiratory rate. And this just gives us an understanding in the baseline before going into anesthesia what to kind of expect. And we can also detect a lot of problems just in the pre-op exam that might prevent us going to anesthesia if we hear an arrhythmia or an abnormal heart sound, or maybe there's excess fluid in the lungs, or maybe there's just just a poor gum color, or if he's real pale. Those would be indications that okay, maybe we'd be a little bit more cautious going into anesthesia. So far, Levi, being a young dog, he's healthy on his physical exam. She's checking his temperature right now, just make sure he's not running any fever. This also allows us, particularly in small dogs, to get a gauge of where their temperature is going in, because a problem in anesthesia is hypothermia. That means temperature getting too low. If they're starting out on the low end of normal, that puts them at risk. So we might, in those cases, we might pre-warm a patient to get them towards the upper end of normal. Whereas in Levi, he's not gonna dissipate heat as much as the smaller dogs, as dogs under 5 and 10 pounds. So we don't have to be as cautious with falling temperatures, but we always want to get that baseline and monitor regular throughout anesthesia.
Big old baby. Maybe I should just shave you down and have you under the pressure. Huh? Okay. Yeah, I found it.
Levi belongs to Sarah. He's her dog, so she's a little tough on him sometimes, but he's a pretty good boy.
Got too much hair. Good boy, you say okay. Big pinch, 1, 2, 3. Yes, you're a good boy. Really?
Nice. So Sarah's putting in that IV catheter right now.
Wait, stay.
The catheter is placed,
Stay.
although this is not an abnormal response from our patients. So we always say the catheter is never in until it gets taped in. I'm going to help. Hey, buddy.
Lay back.
I'm going to help. There you go. Good boy.
Stay right here with me. Look.
So,
Put your foot.
catheter's not in unless it's taped in for this very reason. So just because we get a catheter in doesn't mean the patient necessarily wants it in his arm. So we have to use a multi-person approach a lot of times to calm these guys and make sure that they go in okay.
See, look.
And it stays where it's supposed to.
Wait, buddy, we're almost done. Yeah, no, give that back. Buddy, I promise we're almost done, okay? No.
Easy, bud. I know. Easy.
Hey.
Levi.
Levi.
Hey.
Stop. You're not being a very good role model. Look, now we gotta give you pink vet wrap. No, you wait.
I know. It's okay, buddy.
Hey.
Hang on.
Buddy, I just need to flush it. Let me see your paw again. Oh yeah, we are all set. Okay.
Good deal. So Sarah just checked the patency of the IV catheter with some saline just to make sure it was flowing in where it's supposed to.
Yes, I know.
Especially since he kind of wiggled a little bit. We want to make sure that that IV is good. So when we give the pre-anesthetic, which we'll talk about here in a minute, goes where it's supposed to go and not outside the vein, which can burn sometimes. So make sure that that's good.
What are you
Awesome.
doing?